The Woman trial is coordinated by the Trials Coordinating Centre at the London School of Hygiene and Tropical Medicine. The purpose of this training video is to outline the procedures for the trial. Please make sure that everyone involved in the trial in your hospital will have the opportunity to view this video. After viewing, if you still have any questions, please contact the Coordinating Centre. When your hospital is ready to start, you will receive the following materials. Your investigator's study file contains all the forms, information and guidance you need for conducting the trial. The wall posters detail the outline of the trial and the randomization process. Also included are spare copies of the patient information sheets and consent forms translated into the languages of your country. Please use the presentations provided to train your trial team. A GCP training program is available via the collaborators intranet on the trial website. Initially, you will receive one drug box containing 8 treatment packs, entry forms and outcome forms, as well as patient information sheets and consent forms. Each time you receive a drug box, you will need to confirm receipt to the Coordinating Centre. When you start randomizing patients, we will monitor your drug stock every day and will automatically send you new supplies before you've used up all packs. It's very important that you send all the patient entry forms to the Coordinating Centre as soon as possible after randomization, as this is the only way that we will find out when you've used a pack. Remember to list all team members who have responsibilities in the trial on the delegation log. Please let us know if you need any more of the trial materials or if there's anything specific that would make the trial easier for you. General information leaflets for pregnant women are included in your starter pack. Please distribute them to your antenatal clinics and any other clinics where the women in your area go to have their antenatal checks. When postpartum hemorrhage has been diagnosed, the woman should receive all standard treatments for postpartum hemorrhage as per your hospital protocol. The entry form is completed from the patient's hospital notes to assess eligibility. A woman is eligible if she's legally adult, if the clinician has diagnosed postpartum hemorrhage, and if there's no indication or contraindication to tranexamic acid. In some countries, legally adult means 16 years or older, and in other countries it means 18 years or older. You can see the randomization process on your wall posters and pocket cards. Before assessing the woman, we suggest you take with you the entry form, patient information sheet and consent form from the drug box. If the woman is fully conscious, you can tell her and any relative present about the trial, and she should be able to consent for herself. You should give them enough time to make a decision and answer any questions that they may have, bearing in mind the urgency of the situation. In some situations, it's not possible for the woman to consent for herself. If there's a relative or friend present, discuss the trial with them and ask if they are willing to consent for the woman to take part in the trial. Remember that you need to give a copy of the signed consent form to the relative and keep a copy for the medical records. The original signed consent form must be filed in the study file. Even if the woman is not well enough to give consent and there's no relative present, you can still enter her into the trial if your ethics committee has given approval to no consent. This procedure must be recorded in the woman's medical records. Some women may arrive having given birth and with an established postpartum hemorrhage. Women may also be eligible having delivered by caesarean section.